Shall I start?
Yes, I think so.
A very good evening to everyone. On
Hi
behalf
everyone,
of
we are live.
on behalf of an Indian Thyroid Society, I welcome you all for this Thyroid Live program. Today, we will discuss
Okay.
everything about thyroid eye disease. So we have our respected panelist, and I welcome the panelist and all the audience who have joined for this live program. I request all the audience who have joined to post their questions as we discuss everything about thyroid eye disease. Myself, Dr. Anis Joseph, I am working as consultant endocrinologist at MOIC Medical College, Kolancheri. And I would like to welcome the panelist to this live series. So, first panelist is Dr. Suresh Sir. He is the HOD in the Department of Endocrinology, All India Institute of Medical Science, Mangalagiri. He's an excellent clinician and a great teacher. He has received the State Teacher Award by Andhra Pradesh government in 2018 and has also received various fellowships and scholarship to be trained in UK from in 2005. I welcome you, sir.
Thank
Next panelist is Dr. Saurabha Bhatt. She is an associate professor at Yenapoya Medical College, Mangalore. She has great achievements in her career. Her one of which is the Yuvaratna Award awarded by Endocrine Society of India. She is a recipient of the same in 2024, and also she has received National Young Academic Excellence Awards in 2024 by Indian Medical Association. I welcome ma'am to this live series.
Thank you.
Our next panelist is an eminent ophthalmologist and aesthetic surgeon, Dr. Agriti. She has high volume research in the high volume research in Graves' disease orbitopathy. I welcome ma'am to this live session. Our next panelist is Dr. Vaibhav Padak. He's a consultant in Department of Endocrinology at Medanta Hospital, Lucknow. I welcome Dr. Vaibhav to this session.
Thank you. Thank you.
So we will, with this, we will go on to our discussion. The first question to our Suresh sir. Sir, what exactly is thyroid eye disease?
So thyroid is a gland which is located in the neck. It produces a hormone called thyroxine. In some conditions, levels are elevated. For example, there is a condition called Graves' disease. So in association with Graves' disease, there is an eye disease which develops in some of them. Around 20% of them will have an eye disease. This eye disease consists of swelling and redness of the eyes. So this intrinsically connected eye disease is called Graves' ophthalmopathy. But another name for that is thyroid eye disease. Sometimes it occurs in people with normal thyroid function, and occasionally, very occasionally, it occurs in people with low thyroid function also. But most cases are having high thyroid function. So because of this close association, it's called thyroid eye disease.
So, sir has said thyroid eye disease is something which is occur in patients with most commonly occur in patients with hyperthyroidism. Most commonly, it is present as swelling of the eyelids. So, thank you, sir. The next question to Saurabha ma'am. Ma'am, how though sir has already explained, I would like you to explain in detail how is it related to thyroid dysfunction.
Yes. So thyroid eye disease most commonly occurs in patients with hyperthyroidism. That is, in whom a disease condition where thyroid hormone is increased. That is, it's a autoimmune condition, and 90% of the cases it is associated with this. In about 10%, the thyroid hormone levels may be low. That is, a patient may be hypothyroid, or patient can also be euthyroid, that is the thyroid hormone levels can be normal. मतलब ये थायराइड एसोसिएटेड ऑर्बिटोपैथी आंखों का जो बीमारी है, थायराइड बीमारी के साथ जो एसोसिएटेड है, तो 90% मरीजों में ये ग्रेव्स डिसीज के साथ ये होता है, और 10% पेशेंट का थायराइड लेवल्स नॉर्मल हो सकता है, नहीं तो कम हो सकता है, उनको हाइपोथायरॉयडिज्म हो सकता है.
Thank you, ma'am. Ma'am has explained it very well that thyroid eye disease is most commonly, 90% of the cases, thyroid eye disease is commonly seen in patients with hyperthyroidism, that is high thyroid with high thyroid levels. Next question is to Akriti, ma'am. Ma'am, what are the common symptoms you see in patients with thyroid eye disease and how does it affect the person's quality of life?
Okay. Thank you so much. This is a very pertinent question, Anis. And like Dr. Saurabha and Sureshwar has already mentioned, that it can occur in hypo, or low euthyroid, that is normal thyroid hormones also. So there are three structures in the eye which are mainly affected. One is the lacrimal gland, which produces tears, and this can cause dryness of eyes, some feeling like जैसा आँख में कुछ चुभ रहा है, सूखा है. And when the muscles also are affected, the eye muscles which move the eye, तो मांसपेशी साइज में बढ़ जाती है. तो इस वजह से डबल दिखना, ऊपर या नीचे देखते वक्त तिरछापन भी दिखना, सीधे देखते वक्त भी कभी कभी तिरछापन दिख सकता है. स्क्विंटिंग ऑफ आई is a possibility. And the eye looks bigger, and a person can look angrier or scared or startled. एंड बहुत कम केस में पीछे भी दबाव आने से फैट भी बढ़ जाता है, तो उसमें नस में भी दबाव आ सकता है. तो आंखों के पीछे जो फैट होता है, जो मसल होता है, ये तीन चीज और ग्लैंड, ये तीन चीजें अफेक्ट होती है. तो नजर भी अफेक्ट हो सकती है, तिरछापन भी दिख सकता है, और आंखें बड़ी दिखती है. ये तीन चीजें कॉमनली दिखती है.
Thank you, ma'am. Ma'am has explained it that the most common symptoms are swelling of the eyelids, and people may say that okay, eyes are coming out. That kind of a feeling patient can have, or they can have dryness. They can have double vision or blurring of vision. So those are the most common complaints associated with thyroid eye disease. So next questions to Dr. Vaibhav. Dr. Vaibhav, how is thyroid eye disease is diagnosed? What tests are usually done to diagnose this condition?
यस अगेन थैंक यू. सभी लोगों ने हमें अभी तक ये समझाया कि थायराइड आई डिजीज क्या है, थायराइड आई डिजीज किन मरीजों को हो सकता है, और आकृति मैम ने हमें ये भी समझाया कि इस बीमारी के लक्षण क्या हो सकते हैं. अब रही बात कि इस चीज की डायग्नोसिस कैसे पता लगेगी, हमें क्या टेस्ट करने हैं और कैसे हम डायग्नोस करेंगे. तो हमारे सभी दर्शकों को ये समझना जरूरी है कि अगर आपको किसी भी तरह की थायराइड की समस्या है, वो हाइपो हो, हाइपर हो, और अगर आपको आंखों में कोई भी लक्षण जो आकृति में हमने हमें बताया, जैसे कि आंखों में सूखापन रहना, आंखों की मूवमेंट में हमें कोई दर्द होना, या आंखों की मूवमेंट रिस्ट्रिक्टेड होना, जिसको हम ऐसे कह लें कि मैडम ने हमें बताया कि डबल विजन, जो डिप्लोपिया जिसको कहते हैं, दो दिखना, इस तरह की अगर कोई दिक्कत हो, तो हमें ये समझना है, हमें ये सस्पेक्ट करना है एज ए पेशेंट ऑल्सो कि हमें कोई थायराइड रिलेटेड आंख की प्रॉब्लम हो सकती है. अब डायग्नोसिस हमारे डॉक्टर इस चीज को कैसे बनाएंगे, या एज ए डॉक्टर हम इस चीज की डायग्नोसिस कैसे बनाते हैं? तो हमें मरीज की हिस्ट्री, अगर आपको इस तरह की कोई हिस्ट्री है थायराइड की समस्या, और उसके साथ साथ आंखों में अगर इस तरह की कोई दिक्कतें हैं, तो सस्पिशन बढ़ता है कि आपको थायराइड आई डिजीज हो सकता है. इसके साथ अब हम ऐसे कहें कि डायग्नोसिस कैसे बनेगी, तो प्राइमरीली हम ऐसे कहेंगे कि क्लिनिकल डायग्नोसिस होती है, मरीज के सिम्टम्स, और उसके साथ हमारी आंखों की जो एग्जामिनेशन होती है. एग्जामिनेशन में हम क्या क्या देखते हैं एज ए डॉक्टर, हम देखना होता है कि आंखों की पुतलियों की साइज कैसी है. जैसे मैम ने हमें बताया कि स्टेयर लुक है, तो पुतलियां दोनों अलग अलग, उनकी दूरियां बढ़ जाती हैं, वो हमें मेजर करना होता है. इसके साथ साथ आंखें प्रोप्टोसिस, जिसको आंखें बाहर आ जाती हैं, उसकी एक मेजरमेंट होती है, वो एज ए डॉक्टर हमें करना होता है. और आंखों की मूवमेंट को चेक करना होता है कि आंखों की मूवमेंट में कहीं पेन तो नहीं है, आंखों की मूवमेंट रेस्ट्रिक्टेड तो नहीं है. ये सारी चीजें क्लिनिकल एग्जामिनेशन में हम पता कर सकते हैं, और आपके सिम्टम्स और क्लिनिकल एग्जामिनेशन को मैच करके हम एक इस डायग्नोसिस पर पहुंचते हैं कि आपको थायराइड आई डिजीज है या नहीं है. इसके साथ अब रही बात कि क्या हमें किन किन टेस्ट की जरूरत है, तो कुछ महत्वपूर्ण टेस्ट बहुत ही जरूरी होते हैं अगर हम किसी को थायराइड आई डिजीज की डायग्नोसिस बनाते हैं, जिसमें कि अब अगेन आपको थायराइड की समस्या है, तो थायराइड रिलेटेड कुछ ब्लड के टेस्ट होंगे, जो कि आपकी बीमारी की स्थिति बताएगा कि आपका हाइपोथायराइडिज्म या हाइपरथायराइडिज्म कितने कंट्रोल लेवल पर है. क्योंकि दोनों बीमारी, हाइपो हो या हाइपर हो, अगर वो कंट्रोल नहीं है, तो हमारी ये समस्या तेजी से बढ़ सकती है. तो कुछ ब्लड इन्वेस्टिगेशन, जिसमें कि थायराइड फंक्शन टेस्ट, कुछ एंटीबॉडीज के टेस्ट होते हैं जो कि आपकी बीमारी की स्थिति के बारे में बता सकते हैं, वो भी आवश्यक होते हैं, जो कि आपकी डॉक्टर अगर एडवाइस करें तो हमें उसको जरूर करना चाहिए। इसके साथ कुछ इमेजिंग के टेस्ट होते हैं जिसको हम सीटी या एमआरआई कहते हैं, वो आंखों की सीटी या एमआरआई। ये हमारे दर्शकों को समझना जरूरी है कि हर एक मरीज में वो आवश्यक नहीं होता है। कुछ मरीजों में ही जो आपके डॉक्टर डिसीजन इस चीज को बनाएंगे उनमें आवश्यक होता है। जैसे कि कुछ, एक उदाहरण के तौर पे मैं बताऊं, जिन मरीजों का एक ही आंख इन्वॉल्व है, जैसे कि दोनों, जैसे जनरली हम देखते हैं कि दोनों थायराइड आई डिजीज होती है, दोनों एक साथ होगी, लेकिन कुछ मरीजों में एक ही आंख इन्वॉल्व होती है, वहां हमें थोड़ा सा इमेजिंग की हेल्प लेनी पड़ती है। कुछ मरीजों में हम देखते हैं, जैसा कि सौरभा मैम ने हमें बताया, कि कई बार होता है कि मरीज यू थायराइड है, उसको थायराइड फंक्शन टेस्ट हमारा नॉर्मल दिखा रहा है, बट आंखों में इस तरह की समस्याएं दिख रही हैं, तो वहां हमें थोड़ी सी एमआरआई या सीटी स्कैन की हेल्प लेनी होती है। कुछ मरीजों में ऑर्बिटल इमेजिंग की इसलिए और जरूरत होती है जहां पर हमारी सस्पिशन रहती है, हमारे डॉक्टर एज ए डॉक्टर की, कई बार जो हमारी नर्व होती है, जिन आंखों का नर्व जो इसको कहते हैं ऑप्टिक नर्व, उसकी अगर इन्वॉल्वमेंट हम सस्पिशन करते हैं तो हमें इमेजिंग की जरूरत होती है। तो जस्ट टू समराइज विच आई हैव डिस्कस्ड, कि बेसिकली आपके डॉक्टर एज ए क्लिनिशियन आपकी चीजों को समझ के, सिम्टम को और आंखों की एग्जामिनेशन करके एक डायग्नोसिस पे पहुंच सकते हैं। और कुछ मरीजों में ब्लड टेस्ट जरूरी होता है और कुछ मरीजों में हमें इमेजिंग की हेल्प लेनी होती है।
Thank you, Dr. Vaibhav. In summarizing, so thyroid eye disease is diagnosed based on the examination by your doctor and also certain lab test, which involves the TSH levels, thyroid hormone levels, and also something called thyroid receptor antibody levels. And then followed by on clinical examination by an ophthalmologist where they check your vision, and if needed they will do an MRI, depends on your vision status. So those are in nutshell what Dr. Vaibhav have explained has explained. So we'll go to the next round of questions again to Dr. Suresh sir. Sir, what are the risk factors associated with thyroid eye disease?
So when you say risk factors, it means what are the conditions which increase the likelihood of developing thyroid eye disease. So among them, most important thing is the gender. Like ladies generally have more thyroid eye disease because they have more thyroid disease itself than males. But then the males have more severe disease. So when males have affected with eye disease, the disease tends to be more severe. Then second thing is smoking is a very important factor, and it can be something which you can also modify. So if a person smokes, it is likely to have more chance of developing eye disease, and more severe eye disease is also likely. In addition to that, the method of treatment of the thyroid disease also makes a difference. So settling the thyroid levels is very important. But if you overtreat the thyroid patients with excess medication and make them low thyroid, then and you don't correct that low thyroid status, then it is likely to worsen the eye disease. And there's a modality of treatment of Graves' disease which we call radioactive iodine ablation, wherein you give iodine which contains some rays like radioactivity to burn the thyroid. After this kind of treatment, many people develop thyroid eye disease, or if there was a pre-existing disease, it tends to get worse. So by and large, it is the male gender, the elderly people. Elderly is also a risk factor. Elderly people, those who have been overtreated with medication and cigarette smoking. These are some of the risk factors which, and also treatment with radioactive iodine. These are the things which have a risk factor. Also, family history may also be important. Suppose somebody in the family has got thyroid disease, you're more likely to develop thyroid disease. And in consequence, you're also more likely to develop thyroid eye disease. So that would be the risk factors for this disease.
Thank you, sir. So, what sir has mentioned is the gender, age, the smoking history, stress factors, the level of thyroid hormones in your body, and the what treatment we have used to control the thyroid disease. All that are common risk factors for the development of thyroid eye disease. And also there are some genetic factors which has a role. That's why the family history is also important. So moving on to I request all the audience to post their questions so that we will discuss in between. Next question is to Saurabha ma'am. Ma'am, does it affect vision? So how does it, if so, how does it affect the vision?
Yes, definitely. Thyroid eye disease affects the vision. So in case of mild disease, actually increased tearing will be there, excess tear production. So that can interfere with the vision. There can be what is called photophobia, that is difficulty or discomfort looking in bright light. When there is bright light, that is called photophobia. Then sometimes there can be double vision. Depending on how severe the disease is, double vision can be there. That is, anything appears double, and it can be sometimes corrected with surgery, but otherwise that can be there. Then there may be pain. Sometimes even when looking on either side, pain may be there that may interfere with a full range of vision. Sometimes there can be scarring in the cornea, so that may lead to decrease in vision of either eye. And in severe disease, actually, which can be very dangerous, the optic nerve can be affected. That is, it's called dysthyroid optic neuropathy. So sight loss can be there, severe loss of vision can be there. One of the early symptoms of this is impaired color vision. Color vision may be affected. So, in a number of ways, vision can be affected in thyroid eye disease.
Thank you, ma'am. So the vision is affected because of the involvement of cornea, or it could be because of the nerves in severe conditions. But in mild disease, because of the increased tearing, or because of the pain, that may also affect the vision. Okay. So next question is to Agriti, ma'am. Ma'am, what are the complications you see in when you deal with patients with thyroid eye disease?
So, thyroid eye disease usually has an active phase and a quiescent phase. The active phase can lie between anywhere 2 to 5 years. 2 से 5 साल में active phase होती है. तभी जो patient के symptom होते हैं, it is also more severe in the morning because of the venous stasis, जो blood accumulate होता है. सुबह उठने पे उनको डबल ज्यादा दिखता है, और शाम को सेटल हो जाता है या कम डबल हो जाता है. ये हमें बताता है कि अभी भी डिजीज एक्टिव स्टेज में है, सुबह और शाम के सिम्टम्स में फर्क होना. और बाकी भी कई टेस्ट है, क्लासिफिकेशन 1-2 सिस्टम्स है जिससे हम ग्रेड करते हैं. बट एक्टिव स्टेज के कॉम्प्लिकेशन और क्वाइट स्टेज के कॉम्प्लिकेशन थोड़े थोड़े अलग है. Active stage में what can happen is there can be, like Dr. Saurabha has already mentioned, there can be a scar, but in worst cases there can be an ulcer. छाला पड़ सकता है कॉर्निया में, और छाला पड़ने से क्योंकि उसमें पलकों का कवर नहीं हो पाता, उसमें छेद भी पड़ सकता है, और परमानेंट भी नजर डैमेज हो सकती है अगर वो छाला का जख्म भर ना जाए. दूसरी बात, ऑप्टिक नर्व में जैसे नस में सूजन बाजू में होके नस पे दबाव आने पे जल्दी उसको ट्रीट किया जाए, जैसे स्टीरॉइड से करते हैं, या कभी कभी दूरबीन द्वारा नाक से सर्जरी से भी करते हैं. तो जब वो नस पे दबाव हटा दिया जाए तो नस का फंक्शन पूरी तरह भी वापस आ सकता है. पर ज्यादा समय तक अगर नस पर दबाव बना रहे तो परमानेंट विजन लॉस भी हो सकता है. और क्वाइट स्टेज में जैसे एक टाइम डिजीज अभी ऊपर नीचे नहीं हो रहा है, स्टेबल हो गया है, तभी जैसे कॉर्निया में सफेदी आना और कॉर्निया पतला हो जाना, तो थोड़ी भी चोट लगने से उसमें छेद हो जाना, या फिर मसल मांसपेशी तुम्हारी इतनी कड़क हो जाना कि सर्जरी करने के बाद भी सीधा दिखना थोड़ा मुश्किल रहना. तो जब एक्टिव है तभी सही तरह का ट्रीटमेंट अलग है, और जब क्वाइट हो जाता है तो उसका ट्रीटमेंट थोड़ा अलग हो जाता है. तो नजर में छाला पड़ना और नस पे दबाव होना ये सबसे ज्यादा इम्पोर्टेंट कॉम्प्लिकेशन है. तिरछापन खैर सिर्फ बाहर दिखने में अच्छा नहीं दिखता है, या डबल दिख सकता है, ये एक तीसरी उसकी कॉम्प्लिकेशन हो सकती है.
Thank you, ma'am. What ma'am is summarizing what ma'am has said. Thyroid eye disease can, if left untreated, can compromise your vision. It may involve the optic nerve that can cause impairment of your vision, and also involvement of cornea or corneal ulcer can also lead to loss of vision. So thank you, ma'am, for that valuable information.
आते हुए ये बताऊंगा कि जैसे मैम ने हमें बताया कि दो स्टेजेस होते हैं, एक एक्टिव होता है और एक ऐसे कह लें साधारण भाषा में कि इनएक्टिव. तो और थायराइड आई डिजीज जो आपने पूछा कि प्रोग्रेस करती है कि नहीं, तो जरूर प्रोग्रेस करेगी अगर हम उसका प्रॉपर इलाज समय से नहीं करेंगे तो। इसीलिए जो आपने हमसे पहला सवाल पूछा था उसमें कि डायग्नोसिस कैसे बनाना है, तो डायग्नोसिस कैसे बनाना है उसके साथ साथ सही समय पर बनाना भी डायग्नोसिस बहुत महत्वपूर्ण होता है। कि अगर जैसे कि माइल्ड स्टेज में हम इस बीमारी को जल्दी पकड़ लें या मॉडरेट स्टेज में भी जल्दी हम पकड़ लें तो इलाज उसका संभव है, और इलाज इस हद तक संभव है कि सारी चीजें एकदम ऑलमोस्ट नॉर्मल की जैसी हो सकती हैं। तो एक्टिव डिजीज को हम अगर प्रॉपर तरीके से ट्रीट करते हैं, अप्रोप्रिएट तरीके से, अच्छे तरीके से, जो भी प्रॉपर ट्रीटमेंट हमारे पास उपलब्ध है, तो इस चीज की लगभग ज्यादा से ज्यादा संभावना है कि हम अपनी चीजों को आगे बेहतर कर सकेंगे। लेकिन इस चीज में हमारे मरीजों को जो भी ग्रेव्स डिजीज के या हाइपोथायराइडिज्म की जिनको आंखों की समस्या है वो ये सुन रहे होंगे, इवन बहुत सारे पेशेंट्स को हम प्रॉपर ट्रीटमेंट जो भी हमारे पास दवाइयां उपलब्ध हैं उनको देने के बाद भी कुछ ना कुछ डिसफिगरमेंट रह जाता है। इस बीमारी की कह लें ऐसी खासियत ही ऐसी है कि वो कुछ ना कुछ अपनी छाप या कुछ ना कुछ अपनी चीजें परमानेंट के लिए मरीज की आंखों पर छोड़ जाता है। तो उसके लिए हमें तैयार रहना होता है, और उसके लिए हमें एज ए क्लिनिशियन तैयार होना होता है, और हमारे पास अच्छे ऑप्थेल्मोलॉजिकल सर्जन की जरूरत होती है जो अगर कोई बीमारी हमारी उस तरह की कोई छाप छोड़ के चली गई, जैसा कि मैम ने बताया तिरछा देखना या कुछ मांसपेशियों को जो हमारी आंखों की मसल्स हैं उनकी टाइटनेस हो जाना, तो उस तरह की कुछ समस्याएं अच्छी ट्रीटमेंट के बावजूद भी रह सकती है। तो उसके लिए हमारे पास भी विकल्प है, हमारे पास भी सुविधाएं हैं जिसमें हम उसकी चीजों को सर्जरी कर करके एक मरीज को बेहतर से बेहतर लाइफ या जिंदगी देने की कोशिश कर सकते हैं कि उनको किसी तरह की आंखों से देखने में या आंखों की किसी मूवमेंट में किसी तरह की कोई परेशानी ना हो।
Thank you, Dr. Vaibhav. So, thyroid eye disease, the severity and the depends on there are various risk factors which sir has told, like male gender, smoking, stress, all that can lead to progression of the disease. Mild disease may not progress, but the severe disease can progress and lead to complications such as vision loss. Sometimes they can develop squint. So, it's important to address at the earliest to prevent these complications. So next question to Dr. Suresh sir. So what are the treatment options available for thyroid eye disease?
So like any disease, the treatment options will be medical and surgical and some lifestyle aspects also. So the first part is to stabilize the thyroid hormone levels, bring it down to the normal range, but do not overtreat. And that can be done either by medical or by surgical means, including surgery of the thyroid. Mostly it is medical initially, and if the medical treatment fails, then you go for the surgical treatment. But among this treatment, you should not go for radioactive iodine ablation. That is one of the, that's the third kind of treatment for high thyroid hormone levels, but we should not go for that treatment because it tends to worsen the eye disease. So that is the first part. The second part is like the lifestyle aspects with the smoking, and if there is a lot of glare, then you can wear dark glasses. If the eyes are getting dry, you can use artificial tears. While sleeping at night, you can use an ointment so that the eyes do not get dried up. That part is general care of the eye. The third part will be, since this is, as somebody mentioned, this is an autoimmune disease. Autoimmune means that the body is mounting an immune reaction to a part of itself. In this case, the immune reaction is to the eye. So there are drugs which suppress the immunity, and among them, very important category of drugs are what we call steroids. So these steroids are given weekly once for up to 12 weeks, 8 weeks, and in that process, the swelling of the eyes will go away. But this treatment is generally given only in the active phase, what we have already told about. Active phase when the eyes are swollen and red. And sometimes the steroid treatment, one course is not sufficient. Then you may have to give some irradiation also to the eye to stabilize the eye and to reduce the swelling in the eye. But then once the swelling in the eye has been controlled, like Dr. Vaibhav said, that things are left behind. Some छाप रह जाती है, so that part also has to be corrected. Suppose there's a squint, then that squint has to be corrected. Suppose the eye is very prominent and coming out, that eye has to be settled inside. So those things will require surgical treatment. But once the disease is burnt out, before the disease is burnt out, the only thing you can do is give anti immunity agents which target your immunity, like steroids. Of course, there are newer drugs also coming up which also target immunity. but they're very costly, and mostly we treat with steroids only at the active stage. The late stage, we may have to go for surgical correction of any defects which are still present in the eye.
Thank you, sir. So the treatment include lifestyle measures, which is quitting of smoking, reducing the stress. Second is to control the hyperthyroidism. Third, as control the hyperthyroidism, and third is the specific treatment related to eye, which is depends on the active stage or quiescent stage. You give steroids and other agents to decrease the immunity, and the fourth stage will be surgical measures. So the next question is to Dr. Saurabha. Ma'am, are there any emerging therapies for thyroid eye disease, and what is the role of an endocrinologist in treating thyroid eye disease?
Yeah, so I'll answer the second part first. So, an endocrinologist has a very, very important role because thyroid eye disease, in most of the cases, like up to 80%, it occurs very close to the onset of the disease per se, the thyroid disease. So, patients are more likely to come to the endocrinologist if it is mild. So, then it is important for the endocrinologist to recognize these signs, these mild signs, and advise, as sir was saying, about the measures, the local measures, the lifestyle changes like quitting smoking. So this they can motivate, because we are primarily giving the medical treatment for the disease, primary disease. So patients will understand to recognize and to take the measures. We can counsel them. Also, we when it is severe, it is we must recognize, and our responsibility is there to refer them to the ophthalmologist when surgical measures are required. So when it is severe, we need to refer. So we have a very important role. Regarding the first part of your question, the emerging therapies are there, but like how sir was saying, it may be limited by cost. So that is an important factor while treating. But we generally, in general, immunosuppressants have been used, like that is like steroids, others which reduce the body's immunity. But there are some specific monoclonal antibodies. They are antibodies which are produced synthetically, and they are supposed to act on the TSH receptor antibody itself, the TSH receptor itself. So targeting the TSH receptor, these also act on the disease per se. So small molecule TSH receptor, TSH targets, anti-TSH receptor targeted molecules are there. Then there are some other immunosuppressants like teprotumumab, which is supposed to even reduce the swelling in the eye. But again, it is when it is available, like in the US, it is becoming the drug of choice now. But here, due to non-availability, it's a limiting factor. Then other medication like anti-cholesterol medication may have some role that is being found out, like the statins. They have found that vitamin D is less in these patients. So there are some therapies. Then there are some anti-vascular endothelial growth factor injections. It is found probably they have a role to play. So all these molecules need further robust long-term studies. So actually very few studies are there. We need to see whether in the long term how the outcome it is, how it changes the outcome. So there are a number of emerging therapies, but at the moment steroids, because of the cost, they are the drug of choice.
Thank you, ma'am. An endocrinologist has a very important role in managing thyroid eye disease. Since there are antibodies against there is something called thyroid receptor antibodies, which has an important role in thyroid eye disease. There are medications who target medications which acts against these antibodies, like that alters our immunity levels can be used, like steroids, the MMF, Azoran, or the newer drugs like teprotumumab. All that can be used in treating thyroid eye disease. So the next question to Agriti ma'am. Ma'am, when is the timing of surgery in thyroid eye disease?
So, like Dr. Saurabh had already said, there are endocrinologists plays a major role. So until the hormones are controlled, until the eye disease is stable, we would not intervene. As an oculoplasty specialist, oculoplasty specialist would be the best person to handle thyroid eye disease better than a general ophthalmologist. But it's also that in the active phase, all that we can do is do a tarsography, that is closure of the eyelids. When the eyelids are eyes are bulging out too much and we are unable to close the eyes, just closure of the eyelids to cover the surface so that there is no ulceration of the cornea. That is the only option in active stage, or some injections to close the eyelids like botulinum injection or even steroid injections are given behind the orbit in case of active stage only, because that is the only time it will work. But the actual surgery, which involves orbital decompression, that is for the eye to go back to its normal position, either by removing fat or by removing the thickened bone, thinning it out so that there is space for the eye to go in, would be only once the disease is quiet and the thyroid hormones are in control. Because if this is not done prior to surgery, post surgery, it is likely to worsen. So it is very important that the disease has become quiet and that the thyroid hormones are under control. Thyroid antibody levels are also to be checked before planning a procedure. The surgery is done maybe a year or two. At 1 year, if it is stable, it can be done at 1 year, but definitely not before that, or preferably after 2 years, whenever it's completely burnt out. It is done through hidden incisions in the eyelid crease or even through the conjunctiva from the inside, so there is no scar as such visible. And if there is pressing of the nerve of the eye, it can even be done through a endoscopic approach through the nose by putting the endoscope there and releasing the wall and the pressure on the optic nerve. So these are some ways by which it can be corrected. Also, 90% of patients have the symptom is eyelid retraction, which means that the eye looks big, means the upper eyelid has gone up, which gives them a scary appearance. So even if the eye is not bulging out, the upper eyelid, if it is gone up, it will still look scary, so which can be brought down by surgery. So if that is the only problem, the only upper eyelid can be brought down. But if there is bulging along with that, it can be planned in a staged manner. So surgery is always done in a staged manner. First is decompression to put the eyeball back. Second is if there is strabismus squinting, then that has to be tackled second. And third is the eyelid position. So what is important from patient's perspective is they should be prepared that it will take 3 to 4 months or sometimes even 6 months for the whole process to get done. So I've had patients who say I have a wedding coming up in 2 months and I need to get this done. So the whole healing and settling down is less likely to happen in that time. So that much time needs to be given prior to surgery. Before any event is there, you must plan it in advance. That is what I would like to convey.
Thank you, ma'am. So surgery is not planned when the disease is inactive, or if there is a emergency decompression needed, if there is a vision loss due to compression of the nerve. So, and all things to remember that this is a stage procedure. So the surgery is done in different stages. So it usually takes long time. In different stages, we do the corrective surgeries. So it takes a long time. That is what we have to understand. And next question to Dr. Vaibhav. What is the role of lifestyle measures and what are the psychological support that we should provide for our patients?
यस सो इसमें हमें ये समझना है, और हमारे जो भी मरीज या दर्शक इस चीज़ को सुन रहे हैं, और ऐसे अगर मैं समझाऊं कि कोई भी व्यक्ति अगर थायराइड का मरीज है और उसको आंखों में जो भी हम लोगों ने अभी तक चर्चा करी कि क्या क्या लक्षण हो सकते हैं, क्या क्या आंखों में दिक्कतें हो सकती हैं, अगर कोई भी सुनने वाला मरीज इस चीज को ये समझे कि हम अगर किसी जलती हुई आग में पेट्रोल डालें तो क्या होगा, तो उसी तरीके से स्मोकिंग एक ऐसी चीज होती है कि अगर किसी भी व्यक्ति को थायराइड की आंख वाली किसी तरह की कोई समस्या है, तो उस तरीके से ये समझे कि स्मोकिंग उसमें वैसा ही काम करता है। तो हमारा पहला यही सभी से निवेदन रहेगा कि अगर आपको थायराइड की कोई समस्या है, थायराइड आई रिलेटेड समस्या है, तो स्मोकिंग से दूरी बनाएं, पहली चीज। दूसरी चीज, इसमें और भी लाइफस्टाइल मेजर्स हैं, जैसे कि कुछ सौरभा मैम ने भी हमें बताया कि हमें डायबिटीज के बारे में कंट्रोल रखना है। कई बार थायराइड के मरीजों को डायबिटीज रहता है, तो डायबिटीज पर ध्यान बनाए रखना चाहिए। कोलेस्ट्रॉल भी इस चीजों में रोल प्ले कर सकता है, तो कोलेस्ट्रॉल की मात्रा का भी नियंत्रण रखना होता है। और बाकी ब्लड प्रेशर वगैरह की चीजों को हमें ध्यान रखना है। और लाइफस्टाइल मेजर जैसे कि आंखों के बारे में हम बात कर रहे हैं, तो इन मरीजों को जो होते हैं, जिनको ड्राई आई की समस्या होती है या डबल विजन की समस्या होती है, इनको गॉगल्स यूज करने के लिए जनरली एडवाइस किया जाता है कि आप गॉगल्स यूज करें, जिससे कि आपको इस तरह की समस्याओं में दिक्कत ना हो। इसके अलावा आकृति मैम ने हमें बताया सर्जरीज के बारे में, बाकी हमने दवाओं के बारे में डिस्कस किया। लेकिन कुछ मरीजों को हमें ये भी बताना होता है कि एक आई ड्रॉप्स होते हैं जिससे कि ड्राइनेस कम होती है, वो अगर आपके ऑफ्थेल्मोलॉजिस्ट बताते हैं, आपके एंडोक्राइनोलॉजिस्ट बताते हैं, तो उनका भी हम यूज कर सकते हैं। आपके दूसरे सवाल का जवाब, और दूसरा सवाल बहुत ही महत्वपूर्ण पहलू है, और वो हर एक बीमारी के लिए महत्वपूर्ण होता है। किसी भी बीमारी में हमें मानसिक चिंता और तनाव का ध्यान रखना होता है, और उसी में साइकोलॉजिकल सपोर्ट बहुत इंपॉर्टेंट रोल प्ले करता है। और इस बीमारी की, जैसे मैंने बताया, इस बीमारी की खासियत ऐसी है कि ये बीमारी अपनी निशानी छोड़कर जाता है किसी भी मरीज की आंखों पर। और आंखें हमारी ऐसी हैं, आंखें हमारी शरीर का ऐसा अंग है जो हमें खूबसूरत बनाती हैं या हमारी चेहरे को सुंदरता देती हैं। और इसमें किसी भी मरीज के लिए साइकोलॉजिकल सपोर्ट, जो कि डॉक्टर पॉइंट ऑफ व्यू से भी और मरीजों के फैमिली को भी इस चीज का ध्यान रखना होता है कि जब ये बीमारी एक्टिव रहती है या बीमारी एक्टिव ना होने के बाद भी जब बीमारी का लेटर स्टेज आता है, तब आंखों की तमाम दिक्कतों की वजह से मरीज को एक मेंटल स्ट्रेस, मेंटल प्रॉब्लम्स हो सकती हैं, जिसकी वजह से आगे और तनाव बढ़ सकता है। लेकिन जैसा कि आकृति मैम ने इस सवाल के पहले हमें समझाया कि मैम के पास तमाम तरह की तकनीक हैं, जिसके जिसकी यूज से मैम हमारी आंखों को फिर से सुंदर बना सकती हैं। तो हमारे सुनने वाले किसी मरीज को किसी तरीके की मानसिक चिंता तनाव नहीं लेनी है। अगर हमारे पास अच्छे एंडोक्राइनोलॉजिस्ट हैं और हमारे पास आकृति मैम जैसे अच्छे सर्जन्स हैं, तो हम अपनी आंखों की सुंदरता को फिर से वापस पा सकते हैं, अपनी थायराइड की बीमारी को कंट्रोल करके और अच्छी से अच्छी सर्जरी करा के। तो सभी जो थायराइड के मरीज हैं और उनके फैमिली मेंबर्स अगर सुन रहे हैं, तो ये मानसिक चिंता तनाव होता है बीमारी के दौरान, लेकिन हमें अपना धैर्य बनाए रखना होता है कि अच्छे हाथों में, अच्छे डॉक्टर के हाथों में, अच्छे सर्जन के हाथों में हम अपनी सुंदरता पुनः वापस पा सकते हैं।
Thank you, Dr. Viper. Along with medications and surgery, the lifestyle measures also play an important role, like quitting of smoking and also avoiding stress, and also wearing small measures like goggles. All that plays a significant role in treating patients with thyroid eye disease. And also, the psychological support has a very important role because this is a very long term. The patient has to come to multiple times to the hospital, multiple visit to ophthalmologist and endocrinologist. So psychological support by the treating doctors and family members is also very important. Okay. Dr. Vaibhav, can you suggest one take home message from this discussion?
यस, अगेन मैंने पहले भी इस पॉइंट पर एम्फेसाइज किया है और बताने की कोशिश की, और मेरा सभी से यही मैसेज भी रहेगा कि अगर आप थायराइड के मरीज हैं और आपको आंखों में किसी तरह की कोई समस्या है जो आपकी डॉक्टर ने आपको अलर्ट किया है या बताया है, या आंखों की किसी तरह की थायराइड रिलेटेड दवा चल रही है, तो स्मोकिंग से दूरी बनाएं। बस ये रहेगा मैसेज हमारे तरफ से। स्मोकिंग को अगर आप रोकते हैं, तो हमें ये मानना पड़ेगा, ये जानते हैं हम सभी, लिटरेचर भी बताती है कि स्मोकिंग को रोकने से आपकी बीमारी की एक्टिविटी भी कम हो जाएगी और आपके डॉक्टर का काम आसान हो जाएगा आपकी बीमारी को ट्रीट करने में।
Thank you, Dr. Vaibhav. Agriti ma'am, can you give us one take home message from this discussion?
जी, मेरा टेक होम मैसेज यही होगा कि थायराइड आई डिजीज से डरिए नहीं, इसका इलाज है। सही समय पे आप एंडोक्राइनोलॉजिस्ट को दिखाना और ऑक्यूलोप्लास्टी स्पेशलिस्ट को दिखाना ज़रूरी है, ताकि शुरुआत में ही ये नियंत्रण में रहे। क्योंकि ये भी हम देखते हैं कि स्टेरॉयड कभी दी जाती है जब डिजीज बर्नट आउट हो जाता है, तभी उसका कोई रोल नहीं होता, तभी वो काम नहीं करेगी वो पेशेंट पे। तो तभी लेने से बेहतर है कि शुरुआत में ही आप सही समय पर, आपको जैसे कलर में फर्क रखना, लाल रंग फीका लगने लगना, आंखें बड़ी लगना, ये शुरुआत में जब महसूस हो तभी एंडोक्राइनोलॉजिस्ट के पास जाइए, और ऑक्यूलो स्पेशलिस्ट, ऑक्यूलोप्लास्टी स्पेशलिस्ट सर्जन के पास भी वो आपको रेफर कर देंगे, ताकि आपका सही समय से, सही तरह से, एकदम नियमित रूप से आपका इलाज हो पाए।
So, Saurabha ma'am, can you give us your take-home message?
Yes, so I would like to tell all the viewers that be assured that the help is available from endocrinologists and ophthalmologists. So when you are concerned whether it is actually anything related to the thyroid, please consult the ophthalmologist, please consult the endocrinologist and clarify, because sometimes there are other mimickers which are very similar to thyroid eye disease. So it's important to recognize and not assume it is because of this. So help is available, and timely follow up and compliance with the tablets, like taking the tablets correctly, uninterrupted, and also refrain from smoking. I think I would
Suresh
convey
sir,
this message to all of you.
Yeah, so
Yes.
basically, as far as the thyroid eye disease is concerned, we have to, as the patient comes first to the endocrinologist, we have to stabilize the thyroid levels without over treating the thyroid. So that's very important. So patients should follow up regularly, take their medicines regularly. And after, let us say, around 18 months of treatment, if they still have some thyroid dysfunction, then they might consider going for surgery. But do not use the radioactive iodine ablation route, even though that is a less painful route. But in the setting of eye disease, if you're not having eye disease, it's okay to go for that. But especially active eye disease. So that would be one, follow up regularly with the endocrinologist, do your thyroid functions regularly so that you don't get over treated. And at the same time, you are not under treated also. So you should not have fluctuating thyroid functions. So that can only happen when you follow up at least 6 weekly intervals with your endocrinologist. So that would be very useful thing to ameliorate your eye disease, or at least keep it stable. And of course, later stages, you can treat. The treatment is available in the form of immunosuppression. And if anything is left behind in the eye, you can always go for the eye surgery. So I think there's nothing to worry about this condition. Loss of vision is extremely uncommon, and it doesn't happen very frequently. And there are interventions available to prevent any such thing.
Thank you, sir. In summarizing, do not panic if you have thyroid eye disease. The treatment is mainly by a multidisciplinary team by an endocrinologist and ophthalmologist. If you have the correct diagnosis and at the correct time. So, if you have any eye swelling or redness of eyes, and you are already a patient who has hyperthyroidism, it's important to consult endocrinologist and ophthalmologist at the earliest. If we diagnose this condition at the early with the correct treatment, lot of treatment options are available. Which involves lifestyle measures. Everybody re-emphasize the fact that we should that the person who has thyroid eye disease should restrain from smoking. Quitting smoking is very important in treating this disease, and for the effect of medicine also, the quitting of smoking is very important. So the patient should not smoke. That is one important take-home message. And other thing, frequent follow-up is needed to both endocrinologist and to the ophthalmologist to start the correct treatment at the correct time, and patient should have a correct follow-up. So with all these measures, we can treat the thyroid eye disease, and the all the complications can be prevented. So this is this is summarized. This is in summary of all the take-home message. I would like to thank all the respected panelists for your valuable input to this discussion. And I would also like to thank all the audience who have joined for this discussion. And I would like to thank Indian Thyroid Society for giving us this great opportunity. And this is a online series planned, and the next meeting will be on March 15th, where the topic of discussion will be women health and thyroid. Thank you, everyone, and good night.
Thank you.